Hi guys, welcome to my channel. I'm glad you've joined me. If you are new here, hit the subscription button and that notification bell. Share with your friends. The information we are going to share is important. Hemorrhoidectomy. What are hemorrhoids? Hemorrhoids are distended, inflamed veins that are found at the anus or the lower rectum. Now, they are caused by increased anorectal pressure. And what is the cause of this pressure? The pressure can be caused during defecation and it can be due to constipation. How do you know that you are having hemorrhoids? The symptoms. There are 4 cardinal symptoms that you will be able to know that when you have them, you can say, I might be having hemorrhoids. Number 1, there can be rectal bleeding. These veins, they are very pliable. So whenever anything passes there, it can trigger bleeding. That is how you will find that you have rectal bleeding. Number 2 is itchiness. You feel like you need to scratch the area, what we call pruritus. Number 3, there is pain. There is a lot of pain when one has hemorrhoids. And also you can even have prolapse, especially during the time when you are going for the long call. You might realize that some of these veins distend or they move out because they are pushed by the feces, so they are prolapsed, or they just, because they are so big, you can even see them outside. We have some of them. We have 2 types. We have those hemorrhoids which are outside the anus, those ones that you can see, and there are those ones that they are deeper inside, which are only seen when your doctor does an examination, what we call a rectal examination. They'll be able to see them, or even when a colonoscopy is being done. A colonoscopy is an examination where a colonoscope, that is a camera that is passed rectally, and it shows the structures around the place. Sometimes these internal, what we call internal hemorrhoids, are detected during the colonoscopy, or they can also be detected during what we call a proctoscopy. Now, how are we caring, or what can you do if you have hemorrhoids? 2 ways of managing the hemorrhoids. There are some medication that you can be given to relieve pain. So some of these pain medication, because we have said that hemorrhoids are distended veins or inflamed veins, you can be given anti-inflammatory or pain or medication that relieve the pain and also relieve the swelling. Number 2, there can be a procedure that can be done which is known as hemorrhoidectomy. Hemorrhoidectomy is a surgical procedure that is used for removing or surgically removing the hemorrhoids. And this is done in the operating room. And you will be explained by your perioperative nurse or your surgeon about the preparation that you need to make when you are going in for a hemorrhoidectomy. And some of the preparation could mean that you do not eat any food, so that it helps to have a clear field during the procedure. Now, hemorrhoidectomy, when it is done, post or after the procedure has been done, you will be asked by the doctor to do the following. Number 1, to have pain relieving medication. The pain relieving medication include such medication as ibuprofen, 2 as acetaminophen. After the pain relief, because there is a lot of pain, and this pain that you will experience even after the procedure happens because of what we call spasms of the anal sphincter. The anal sphincter tends to go into spasms. It tends to move the muscle because it's consisting of muscles. Those muscles tend to have quick, fast movements. That is what we call the anal sphincter spasms. This is what causes the pain after the hemorrhoidectomy. and that pain relieving medication is important. The second thing that will be done after hemorrhoidectomy is what we call sitz pads. Sitz pads means that you are going to have water, warm water, where you will add saline, normal saline, and then you will sit in there for some time, as will be advised by the doctor. And you may be able to do this either 3 times in a day, or depending on the number of times that your surgeon will advise you to do. Other things that you are supposed to make sure that they are in place for you to have a successful after the hemorrhoidectomy is also the meals that you are supposed to take. Ensure that you take a soft diet, which will not give you a lot of strain during defecation. The third thing that you are supposed to do post or after hemorrhoidectomy is to make sure that you take fluids. Taking plenty of fluids will help the diet or the meals that you take to be soft, and this will help to aid in, will make you not have any difficulty during when you are having passing your bowels. Also, the other thing that after this soft diet, you may be even be given some medicine that will help the emptying of your stomach. These are some of the things that you are supposed to do post hemorrhoidectomy. And during hemorrhoidectomy, you will be explained to what to do, what to expect. And this hemorrhoidectomy, when it's done, you are going to be given some medicine. You will be given some medicine that will be relieving, that you will not feel pain when it's done. It can be in 2 ways. Either one, you will be given an injection in your lower back, what we call local or spinal anesthesia, or you can even be asked to sleep, what we call general anesthesia. So you will not be feeling any pain during the procedure. So these are the 4 things that I've talked about that you need to do post hemorrhoidectomy. That is sitz bath, pain relieving medication, having a soft liquid diet, and the fourth one is that you can be given medication to make sure that your bowel moves quite easily so that you don't get any problems. So those are the things that you are supposed to bear in mind about hemorrhoidectomy. If you have any questions, please comment below, and see you in the next one. Bye.